Welcome to the Rare Wellness Podcast, where we explore cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments. I'm Dr. Jamie Lewis. Today I'm flying solo, and I'm excited about this one because Dr. Grayton and I just got back from the IOF/TOBI conference. That's the Interventional Orthobiologics Foundation and the Orthobiologic Institute meeting, the premier scientific gathering in the world for regenerative medicine. In the next two episodes, we're going to review where the science is going in regenerative medicine. This podcast is brought to you by the Center for Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.c4rpm.com. Quick disclaimer, this podcast is for educational purposes only and is not medical advice. Always consult a qualified healthcare professional before starting any new treatment. This is actually part one of a two-part series on what's new in regenerative medicine. Today we're focusing entirely on PRP, platelet-rich plasma. Next episode, we'll tackle stem cells. I'm splitting them up because each one deserves real attention, and frankly, the science in both areas has matured a lot in just the last couple of years. Let me start with a quick refresher for anyone new to this. PRP, platelet-rich plasma, is made from your own blood. We draw a sample, spin it in a centrifuge to concentrate the platelets, and then inject that concentrate back into an injured joint or tendon. Platelets are best known for clotting, but they're also tiny packages of growth factors, the signaling molecules that kick off healing. When platelets activate at an injury site, they release those factors and essentially hand the tissue a set of instructions to start repairing. The whole idea behind PRP is to deliver a concentrated dose of your body's own repair signals right where you need them. In our practice, the conditions where PRP earns its keep are knee and other joint osteoarthritis, chronic tendon problems like tennis elbow and rotator cuff, and certain ligament and soft tissue injuries. It's autologous. It comes from you, so there's no rejection risk, and the safety profile is excellent. But here's the thing that frustrates a lot of patients and a lot of doctors. The results in the published literature have been all over the map. Some studies show beautiful benefit. Others show nothing. For years, that inconsistency was used to dismiss the whole therapy. And what this year's science makes clear is that the inconsistency was never really about whether PRP works. It was about how it was being made and dosed. So here's the single biggest theme I took away from this year's conference, and it's been building for a few years now. Dose. We've spent a decade arguing about whether PRP works at all, and it turns out a huge part of that confusion comes down to one thing: how many platelets were actually in the injection. PRP is not one product. Two clinics can both say they offer PRP and deliver wildly different doses. And dose, it turns out, is everything. Let me give you the perfect example. There was a very influential trial called RESTORE, published in JAMA, one of the most prestigious journals in medicine. It was a rigorous, randomized, placebo-controlled study in knee osteoarthritis. And the headline result was that PRP was no better than a placebo saline injection. That made a lot of noise. Headlines everywhere said PRP doesn't work. But here's the catch, and this is the part that didn't make the headlines. When you look at the PRP they actually used, the system delivered a platelet concentration that did not exceed what you'd find in normal whole blood. In other words, they ran a careful, expensive trial testing a product that was no more platelet-rich than normal whole blood. What this study actually taught us is that if you underdose platelets, you will not have a beneficial effect. So knowing your dose is foundational in regenerative medicine. Now contrast that with another body of work, most notably a series of studies led by Dr. Bansal that asked a different question. Not does PRP work, but how much PRP do you actually need? And they came up with a number. Their work points to roughly 10 billion platelets as the dose associated with real, durable benefit in the knee. We're talking improvements in pain and function on standard scoring systems that held up out to a full year. And importantly, they measured the biology too, seeing drops in inflammatory markers like IL-6 and TNF-alpha in the joint. So when the dose was right, you could actually see the inflammation calming down, not just the pain score moving. 10 billion platelets. That's the number worth remembering. To hit it reliably, you often need a higher volume blood draw and a system genuinely capable of concentrating platelets several fold above baseline, not just spinning a tube and hoping. This is exactly why at our practice, we're supported by a full regenerative medicine laboratory, so we can not only concentrate effectively, but also verify the platelets in the final product. Okay, so dose has been a theme for a number of years. The literature is pointing to target numbers of 10 billion platelets for large joints like knees and hips, and 3.5 billion platelets for tendons and ligaments. What's new and exciting in regenerative medicine is looking at some of the proteins and microvesicles, like exosomes, that get left behind when making PRP. Let me explain. When you make PRP, you separate blood into three main layers: concentrated red cells, which are the heaviest, platelets, which are smaller and lighter, and platelet-poor plasma, which is typically discarded. The reason the platelet-poor plasma is discarded is simply a volume issue. You need to take the 60 to 100 cubic centimeters of blood that you drew and turn it into something a joint can actually hold, which is more like 4 to 8 cubic centimeters. So you concentrate the platelets and get rid of the rest. But as it turns out, the platelet-poor plasma has some very useful things in it, like growth factors, alpha-2 macroglobulin, a potent anti-inflammatory protein, and microvesicles, including exosomes. Because they're so small, they don't pack down with the platelets. They stay up in the fraction we usually discard, the platelet-poor plasma. So in a typical prep, we're capturing the platelets and pouring out a gold mine of healing proteins. Let me unpack a couple of these. First, alpha-2 macroglobulin. We just call it A2M. Think of it as a molecular trap. In an arthritic joint, there are destructive enzymes, things like the matrix metalloproteinases, and a particularly nasty one called ADAMS5 that chew up cartilage. A2M grabs those enzymes and inactivates them. It's like a sponge that soaks up the very molecules driving cartilage breakdown. That matters because most arthritis treatments only quiet the pain. They don't touch the underlying degradation. Concentrating. A2M has real potential to slow the destructive side of arthritis itself, which is a fundamentally different goal than masking symptoms. Second, exosomes. These are tiny bubbles that cells release to communicate with each other, packed with signaling molecules and even genetic instructions, little snippets of RNA that tell other cells how to behave, including how to calm inflammation and switch on repair. They're a big reason a lot of regenerative therapies work at all. Autologous exosomes, meaning your own, harvested from your own blood, are one of the hottest areas in the entire field right now, because you get that powerful cell-to-cell signaling without introducing anything foreign. And again, because they're measured in nanometers, far smaller than a platelet, they don't concentrate down with the platelets. They're sitting up in that platelet-poor plasma we've traditionally thrown away. Now, I want to be clear, these autologous exosomes are very different from the allogeneic, donor-derived exosomes you sometimes see marketed. Autologous means they come from your own body, programmed for what your body needs. Allogeneic means they were grown in a petri dish from foreign cells, programmed for the environment of a petri dish. So the frontier, and this was a big topic at the conference, is processing that platelet-poor plasma to capture and concentrate these smaller components. Instead of treating it as waste, we can run it through additional processing to harvest the free growth factors, the A2M and the exosomes, and add them back. The early thinking is that this could substantially amplify both the anti-inflammatory and the healing effect of an orthobiologic injection, giving you the platelets and the full supporting cast. So step back and look at where PRP is in 2026. Theme 1, Get the dose right. Aim for that meaningful platelet number, around 10 billion for large joints and 3.5 billion for tendons and ligaments, instead of an underdose prep that's destined to disappoint. Theme 2. Stop throwing away the rest of the biology. The growth factors, the A2M, and the exosomes in the platelet-poor plasma may be just as important as the platelets themselves. Done together, this is a far more sophisticated and potentially far more effective version of PRP than what most people got just 1 or 2 years ago. The current data is promising, but only registry data is available so far. Hopefully, clinical trials will come in the next year or two. Next time, in part 2, we're going to get into stem cells, what they actually are, what the honest evidence says, and how to separate the real science from the hype. If PRP is about your body's repair signals, stem cells are about the repair cells themselves, and it's a fascinating conversation. Quick recap. PRP works when it's dosed right, around 10 billion platelets for large joints and 3.5 billion for tendons. And a lot of the old PRP doesn't work story comes from trials that simply underdosed it. The exciting frontier is everything beyond the platelet: growth factors, alpha-2 macroglobulin, and your own exosomes, which we've been discarding in the platelet-poor plasma and can now start capturing. Better dose plus the full biology may equal a much better treatment and outcome. Thanks for joining me today. If you found value in today's episode, subscribe, leave a review, and share this podcast with a friend. Your support helps us continue to provide free content to support you on your journey to optimum health. And this is Dr. Lewis reminding you that your body has an incredible ability to heal, thrive, and repair. Sometimes it just needs the right tools to unlock its full potential. We'll see you next time.